Coming up next on Insights on PBS Hawaii, whether you support the Affordable Care Act or not, it's here and it's going to change the way Hawaii residents pay for health care. If you're a senior who needs help with prescription drug costs, or if you simply haven't been able to afford health insurance in the past, the federal law could have a big impact on you. Tonight we ask, how will the Affordable Care Act affect Hawaii seniors, uninsured and part-time workers? Aloha and welcome to Insights on PBS Hawaii. I'm Malia Mattoch. In Hawaii, 92% of residents already have health insurance and may assume that the Affordable Care Act, or Obamacare, won't make a difference. But the federal law is intended to help seniors who rely on Medicaid, particularly those who have struggled to pay for prescription medications in the past. It's also targeted at low and middle-income wage earners who might find more affordable health insurance options and tax credits are available when the Hawaii Health Connector launches in October. What about small business owners who have to make sure every employee who works more than 20 hours a week has adequate health insurance plans for themselves and for their families? The Affordable Care Act aims to help them too. What do Hawaii residents need to know about shopping for health care and health insurance? Tonight we ask, how will the Affordable Care Act affect Hawaii seniors, uninsured and part-time workers? We invite you to join our conversation by calling, emailing, or tweeting your questions and comments. The contact information you now see on your screen will be repeated throughout the program. Insights is also streaming live on your computer and will be posted on our website, pbshawaii.org, after the broadcast. The live stream is closed caption, just like our broadcast. Now to our panel. Tom Matsuda is the Governor's Affordable Care Act Implementation Manager. He is the facilitator and coordinator of the state's responsibilities under the Act of 2010. Cheryl Menor-McNamara is the incoming president of the Chamber of Commerce of Hawaii. She is also the chairwoman of the Hawaii Health Connector, the online marketplace for health insurance. Cheryl Matheis is a senior policy strategist for AARP in Washington, D.C. She has held leadership positions at AARP for the past 25 years and currently focuses on the future of Medicare and Social Security. Tony Saguibo is the Vice President of Government Relations for HMSA, the state's largest health insurer. HMSA is one of the insurance providers that will be offering plans through the Hawaii Health Connector. Thank you all for being here tonight. This is a topic of great importance and a lot of interest to people around the state. Tom, let's start with you. Could you tell us, are we ready for ACA?
Oh, yes, we are. The federal law was passed over 3 years ago, and a lot has already happened. But I think it's getting a lot of attention now because there are some major changes that are coming up in October and especially in January next year when the insurance rules are going to change quite a bit. But all of the stakeholders in Hawaii that are involved in this process have known about this for a long time. They've been preparing for it. And so I would say that we're ready to go.
We're ready to go. Cheryl, what are the misconceptions that you hear out there about ACA, and what's some of the knowledge that people perhaps should tap into before this starts?
Well, I think we hear a lot that people, for instance, that seniors who have Medicare would have to do something. They don't have to do anything. In fact, the impact and the benefits, basically, that seniors are getting from the Affordable Care Act, they've already started to see. They get free preventive care. They get coverage in that coverage gap for their prescription drugs. That's called the donut hole. They get a lot of benefits like that which just automatically come to them, so they don't have to do anything. And I think the other part is that many people actually don't have to do anything. People who already have insurance need not do anything. But on the other hand, this is terrific because you cannot communicate too much about this to people who really do need to do something and who can benefit if they know what to do.
Okay, who are those people? Who should be paying attention to perhaps the connector and that they should be going and looking at that?
And anyone who does not have insurance right now, anyone who does not have health insurance should be looking at that. And then, of course, employers, small businesses with fewer than 25 people, they have a big vested interest in it because they can get credits to help them afford insurance for their folks.
Sherry, perhaps we could talk to you about that from a chamber's perspective. Which businesses qualify for some of the credits that are available through this?
Sure. Our chamber is the largest business organization in the state, and 80% of our members are small businesses with less than 25 employees. So this small business health tax credit is really important, as Cheryl mentioned. It's actually retroactive to 2010, meaning businesses who qualify can claim up to 35% tax credit. And those businesses are those less than 25 employees and also have an annual average salary wages of less than $50,000, as well as an employer paying more than 50% of the premiums. So we're talking about a significant amount. We did some research, and it looks like about 5,000 businesses can claim the maximum amount of the tax credit. Starting January 1st, 2014, that 35% jumps up to 50%. And so that's a huge incentive for small businesses to go to the Health Connector.
Okay, and yet the businesses that fall sort of outside of that group that might not qualify, what should they be paying attention to?
Well, I think as one of the things that we're trying to guide some of the groups that we work with is to focus on some of the changes that are going to be happening in the plan design, some of the things they have to focus on in terms of maybe the contributions that they have to pay. The advantage we have in this state, of course, is that since 1974, we've had in place the Hawaii Prepaid Healthcare Act, and that is why, as you pointed out at the outset, we have such a low uninsured population to begin with. Those small businesses, outside of the small business tax credit, can do exactly what Cheryl said, which is they really don't have to do anything, focus on what they have today, pay attention to notice requirements that they have to share with their employees, but beyond that, just assuring that the coverage that they have in place today that met the Prepaid Healthcare Act requirements remain in force in 2014.
One question I got a lot in talking to friends while I was researching for tonight was a bit of confusion of, oh gosh, I guess I need to go on and look at the connector, but actually the insurance I have right now is sort of fine. Do I have to change? When do I have to change? Tom, you don't necessarily have to change.
That's right. And if you're a small business owner, you do not have to go to the connector, but you can. There are certain benefits, especially the tax credit that Sherry mentioned. If you're an individual and you already have insurance through your employer, you don't really have to change anything. But if you're a part-time worker and you don't have insurance, or if you're unemployed and you don't have insurance, you should really be looking at the connector. Part of that is you can get a tax credit also as an individual to offset the cost of your premium. So there's a real benefit there that people should look at.
Now, of course, there's a lot of good news in this. People are going to be getting, most people probably better insurance coverage out of. There's all sorts of advantages. There are also some disadvantages. There will be some price increases. Can you talk about that, Tim?
Sure. I mean, a couple of the ways in which the plans have to be structured going forward, there were some requirements that came out of the law right at the outset that enhanced the benefits. And the biggest change is that there are 10 essential health benefits that have to be included in the plan overall. Those automatically increase some of the costs associated with the plan. Although we already had fairly rich benefits, all of those benefits will now have to be required. The other component around cost is also just some of the infrastructure costs that are going to have to be incurred to pay for the entire administration of the Affordable Care Act. Those percentages can range right now somewhere between 3% and 5% just to pay for some of the administration in comparison to the dues premium that are paid today. We could talk a little bit more about the way in which rates are going to be calculated and who would have to pay for that and how those would be paid. But I'm not sure if we want to get into that right now.
Well, sorry, go ahead.
One thing that small businesses may want to consider if they have a grandfather plan, meaning if they had a rate plan established prior to March 23, 2010, if they do intend to change that plan after that date, then they will be required to include some of the essential health benefits that Tony just mentioned, and so that could increase the cost.
Are you working with businesses to sort of figure out how they're going to phase in the increased cost into their business. In other words, if those prices go up and they need to pass that on in their prices, it's reflected in their business, that's done gradually rather than suddenly. Is that a discussion that you are having with businesses?
Well, right now we are educating our membership and the business community. So we've been doing that since 2010, holding forums, holding workshops. In fact, Tom was a speaker at one of our workshops. And so just so the business community is educated what the Affordable Care Act is all about, as well as the Hawaii Health Connector. And so that's where we're at right now. And as we move forward and the connector is established and we know more what kind of fees and taxes are could possibly be imposed, that's when we'll start helping businesses.
I think
Go ahead.
Sorry.
Go ahead.
No, I was thinking, I think the issue about what the rates are going to be is one people think about, but the fact of the matter is we don't know. We don't know what competition will bring. Many states, I mean, I work with states across the country, and some of the states have already started coming out with their rates, and frankly, they're not shocking rates. They actually, there are a lot of influences that can help to bring down rates. So it's really, let's wait and see what competition does for these rates. And the reason we have essential health benefits is that, stakeholders decided that those were essential. And that's why, so that people won't have insurance that's not really insurance that, puts limits on the care that they get just when they get sick. So this is a good thing.
You might be paying more, but you'll be getting better coverage in the end. Speaking of competition, Tom, do you think we're going to be seeing additional insurance companies sort of enter into the market as this rolls out?
Yeah, I think some of the smaller insurance companies are maybe just taking a wait-and-see attitude to see what happens in the marketplace, and then if it looks advantageous to them, they might join in. But right now, the fact is, even before Obamacare in Hawaii, there were relatively few insurance companies in the market, and I don't know that that's going to change very much.
All right. We have a question that's come in. How did Hawaii Health Connector come up with 300,000 potential enrollment? Anyone want to address that?
Well, part of that is because the way the connector is designed, it's also going to be doing applications for Medicaid eligible people, low-income people in the community. And already the Department of Human Services for the state is serving close to 300,000 people. So those folks, as they have to renew their Medicaid plans, will be going through the connector starting next year, actually starting this October. So that number partly probably includes the Medicaid folks, but for other folks who are not low income who need insurance, I would say at this point there are going to likely be more individuals who go to the connector if they're seeking insurance. It's really unclear how many small businesses are going to go. We're just going to have to wait and see.
Cheryl, in terms of Medicare patients, should they be concerned by this act, or are these going to be sort of advantageous changes for them?
Well, we think they're going to be good for people, and I think people have already seen it. Medicare beneficiaries now do not pay for their preventive health care. A lot of times when they get a prescription drug, the copayment is zero or very little. They can get all sorts of screening tests that people need to get, tests to screen for diabetes, for high blood pressure, things like that they used to have to pay something out of pocket for, they don't have to pay for now.
One small thing to be wary of that there has been some press about is the potential for scams geared towards seniors. Let's address that. What do seniors need to be careful of?
I mean, first of all, nobody, there are people who will help you, but no one should be charging you for anything having to do with the Affordable Care Act. Nobody should say, I'm going to get you signed up for this. This is not even just for people on Medicare. I mean, it's for anybody. If someone says to you, I can help get you the best deal under the Affordable Care Act and you have to pay me something, they're not legit.
And there's also some conversation about websites that might mimic the connector website and be asking for personal information. That's something to be aware of, right?
Yes.
Yeah, there's only one official exchange for the state of Hawaii, and it's called the Hawaii Health Connector. If anyone else tries to convince you that they are the exchange for Hawaii, they're not legit.
They're not. It's something to be concerned about. Tom, this might be a question for you. The question is from Laurel and Kailua. $6.7 million was granted to 34 community organizations to educate consumers on healthcare reforms. This works out to $200,000 per organization. How will these organizations be held accountable? Any thoughts on that?
That's a federal grant that was administered by the connector. And they did a full procurement process, to see which organizations were the most qualified. The money is going out to those folks to hire and train people to help the public to access the connector and understand the Affordable Care Act. I think the accountable piece is that it's federal money, so there are requirements attached to it. There's compliance and reports and statistics that have to be provided to make sure that the money is being used wisely.
All right. Tony, let's see. Lynn from Hilo. Question, this is quite specific, but will leukemia medication that runs $100,000 a year be covered under ACA? It is a targeted oral drug rather than a standard transfusion. Of course, that's a very specific question.
Yeah, I don't know for sure that specific drug, but generally speaking, pharmacy medication, prescription drug medication is part of one of the essential health benefits, and that is good news, I think, as was pointed out earlier. And so it's possible that it would be. Of course, it is going to be diagnosis specific. I mean, there's going to be all those requirements. I'd love to explore answering the question offline if they want to give us a call. Directly at the health plan.
Those are the specifics
we could
people
really
need
answer that question.
to reach out to ask.
Yeah,
understandably. Sherry, will it be easy to navigate the site and have your questions answered in terms of the Hawaii Health Connector? Can we talk about the site a little bit and that's going to be going up? For people who want to go on and start to figure it out, any advice?
At the beginning of September, the Hawaii Health Connector will be doing a demo, and so they should be looking forward to that information. And they can also find information on hawaiihealthconnector.com, and they have a good website where it answers questions that come up often. And also they have an outreach team available that can answer any questions.
That come up. Cheryl, we were speaking a little earlier. From a national perspective, do you have any sort of thoughts on how you'd like to see the Hawaii Connector operate in terms of accessibility, transparency?
Sure. I mean, I think the point is that you have to assume that people need to hear things a lot of times, and we have a lot of population here that lives in rural areas, hard to get to. Will they know how to use the connector? Can they take advantage of the demonstration? What I have heard is that the demonstration will be in Honolulu, and so is there a way that you use social media or something like that to get that information out to other people? It's going to be a lot of hands-on work, and a lot. I mean, we at AARP have been doing a great deal of work. We have a lot of volunteers throughout the islands, and they go out to their communities and teach people about the Affordable Care Act.
And if I could,
go ahead. I was just going to say, one of the things that I think is important to note, as we talked about earlier, is that a lot of the infrastructure that's already been in place historically, in terms of the way in which people can access information, be able to get information about health plans, will continue to be available. So while the online tools will start to be enhanced and actually bring new ways for people to get information, people can still visit the plans at their offices, or maybe even call in and speak to a live person in the same way that they may have been able to ask those questions before. And so if they don't feel comfortable using online tools, some of those other avenues are still going to be out there.
What has HMSA done to sort of prepare for this rollout?
Oh, I mean, we've done quite a bit of work working with the Hawaii Health Connector, working with the insurance division, looking at making sure that the plans that we make available will meet all of the minimum requirements, but also provide a variety of choices for people who maybe are in different circumstances. The plans, as you know, were specifically designed at levels that mimic metal levels. So platinum being the most robust, the most beneficial, and maybe even bronze or catastrophic care plans that are designed for people who are younger and probably healthier.
Can we talk about catastrophic? I find that interesting, and I also find that brings up the topic of we need young people to sign on for this program for it to work well. Can you explain briefly what catastrophic would be?
I mean, catastrophic care plans are designed really for people who are younger, healthier, and may want to have some protection in case they face a very unforeseen, high-cost situations. So think of somebody who maybe falls off a roof and breaks their spine, or something along those lines, where they're going to need very serious care. It will typically come with a high deductible, but the premium attached will typically be lower, and that is by definition, we want to get them in the pool, because as you know, as you cover people from the young age all the way up to perhaps maybe even Medicare eligibility, the larger the pool, the better we're able to spread the cost over the total population.
Tom, could you address that in terms of getting young people and the importance of getting young people into this system to make it work?
Well, part of the law that I think has gotten a lot of publicity is the individual mandate. The federal law says that everyone in America has to have health insurance starting on January 1 next year. But part of the trade-off, or maybe what's not known as much, is that if you go to the exchange and if you have a certain level of income, 400% of poverty or below, you qualify for a credit that helps you offset the cost. So that's kind of the trade-off. On the one hand, the government says you have to have insurance, but on the other hand, it says we'll help you if it's hard to afford. The other piece is that if you are an individual and you're looking for insurance on the exchange, you will have choices. There will be many different kinds of plans, as Tony was saying, from platinum, gold, silver, and bronze. Those are different levels, different quality of benefits, and different prices. So really, it's an opportunity for you to look and shop and compare for these different kinds of plans and get the one that fits your situation.
Am I right? Currently, if say a young person or any person were to decide not to do this and to live without insurance, the first year the fine through taxes is $95.
Yes.
And then it escalates into sort of hundreds of dollars later down the line, right, to
Yes.
$300. What will happen to this program in Hawaii and nationally if a lot of people just say, I'll just pay the $95? Is that going to jeopardize the program?
Well, I think what's going to happen over time is people are going to figure out that that tax credit is really worth a lot, and that it really does make it affordable. That's maybe the main part of the Affordable Care Act is those tax credits. And then also over time, if folks, just like Tony said, accidents happen. Right. And over time, I think people will figure out that it's better to have reasonable insurance, to account for those unforeseen times than it is to go bare.
And it's interesting because the question I just looked at was from Mike in Hawaii Kai. What if I don't want to buy health insurance? So any other thoughts on this topic?
Well, I mean, the only other point I would make is, it is a mandate. So that was a decision that was made. It is a requirement. It's no less important than having insurance for your car or your home or something along those lines. So it is a requirement. So I think people should look very carefully at it. I think there are cost savings efforts that are built in to try to give people the opportunity to make sure that they can secure a policy based on what they can afford. So I hope that they'll make the decision that it's to do the right thing is to actually buy an insurance plan.
And interesting, Jackie from Kaimuki, I work part-time and don't have insurance, but I go to Kalihi Palama Center, which I like. After January 1st, can I still go there, or am I forced to buy insurance?
Well, yes. The requirement, I think the answer is yes and yes. I totally agree. I think the answer is, as we talked about just a second ago, which is there is a requirement to get it, but there are going to be there's going to be a broad network of providers available through the plans that are going to be offered. So I would make the selection if attending that facility is important, then just make sure you look carefully at who's in and when you're choosing.
They can go ahead and get the insurance and go to Kalihi Palama.
Somebody who works part-time is likely to have an income level that would qualify them for significant subsidies. So they would be getting insurance at a much lower cost than they think they're going to be paying.
Don't turn down the gift.
Right.
Right. Go ahead and go. Okay. One of the selling points of ACA was evidence-based treatment savings. Is anything being introduced to implement evidence-based treatment? Lloyd and Wiley. Any thoughts?
Well, I think that's the big issue, is that healthcare right now costs too much. I mean, that was the driving force behind the law. And there are a number of provisions in the law which are essentially pilot tests or experiments in figuring out how to give people good quality care that's more organized, more coordinated, and cost less. And it's not just that the government has these experiments going on, but private industry is doing it. The insurance companies are doing it because they need to figure out ways to bring down the cost of their product,
Right.
so that people will be able to buy it. So I think there's a lot that's going to be going on to try to make certain that the treatment people get is based on evidence, as opposed to a situation we might have now where, you know, you have treatments that, you know, are all over the map, and the prices are all over the map because, you know, there's no motivation not to prescribe a treatment that somebody wants, even if there's no reason for it.
Right. Any other thoughts on that before I?
Yeah, I mean, the only thing I would add is, I think, as you're pointing out, as was pointed out, you know, the carriers, the insurance companies are working closely with the providers, and we have, for the past few years, been working very closely with our provider community, focusing on quality, focusing on outcomes, trying to establish the appropriate provider-patient relationships that's needed to be able to truly understand how to move the needle forward in total population health management, and really try to see what we can do to bring the medical trend down.
Interesting. These questions, we've sort of touched on this, but it reflects sort of how much information is needed. How can you take advantage of the Hawaii Health Connector if you don't have internet? We had talked about phone, reaching out by phone. Also, our public libraries are a good resource for computer use. Any other thoughts on that question, Sherry?
Well, there will be a call center where individuals and anyone who's interested can call in and ask questions and see how they can get to the website. So there will be different resources.
There aren't drop-in opportunities, though, to actually go physically somewhere, or are there?
There will be, and I don't have the information at this point, but at some point there.
You can apply almost any way that you do now, in person, by telephone, even by email. You do not have to have internet access.
I think the hope is also that a lot of these assisters, these community organizations that are getting funded to go out and reach people in their communities. So the hope is that they will be successful at doing that.
And that's one of the things, you mentioned assisters, navigators, and there will be representation on each island. So it's not Oahu-centric.
Right.
Each island will have the program specialists, navigators, to assist anyone who wants to go on the connector.
A local specialist. This might be a good AARP question. Neil from Honolulu, retired, was self-employed. Am I required to purchase health care for myself and my family?
Well, Neil, yes, you are. Everyone, I mean, that's the individual requirement. Everybody is required to do it. Now, I don't know, Neil, it sounds like Neil is not yet a Medicare beneficiary, because he would have said that probably if he was. So, yes, he is, but the advantage is that the individual purchasing insurance under this is going to pay a lot less than they would be paying now in an individual insurance market, because that's the toughest market for anybody to be in. You know, group insurance, they spread the risk, it's great. Right. But an individual who just goes in and on his own or her own wants to buy insurance has a tough time. And now it's going to be a lot easier, it's going to be less expensive, and they're going to get a better product.
And then hopefully there are also some sort of national benefits in terms of cost savings, the deficit, so on. Tom, could you speak to that in terms of, do you see ACA as a way to actually reduce the overall cost of healthcare in Hawaii?
I think one of the things that's not commonly known is that the Congressional Budget Office did a study after the law was passed. And that office is impartial, it's nonpartisan. And they estimated the cost savings from the Affordable Care Act to be something in the range of $200 billion over the first 10 years. Yeah. So it's not going to add to the deficit, it's going to reduce the deficit.
And here in Hawaii as well, we'll see some savings on a statewide level.
Yes.
I think I could add to that while you might see some costs go up, and we talked a little about fees at the beginning, over time, with the entire nation focused on, trying to improve quality, trying to think about what works, what's the right care at the right time for people, eventually you will start to get personal responsibility baked into the way in which people access the healthcare system. That, with the entire nation sort of moving in that same direction, would logically start to bring some of the cost down.
Here's a question from Lauren in Hilo. Many doctors currently do not accept Medicare because of the low reimbursement. Do you believe this program will encourage more doctors to accept Medicare? Any thoughts?
Well, there are some provisions in this law that increase the payments to physicians under Medicare. So I guess the short answer to that is yes. A doctor can choose not to take more Medicare patients or Medicare patients, but for the most part, physicians do take Medicare patients because they know they're going to get paid, And Medicare really isn't a low reimbursement rate for the most part. Now, there are some challenges under Medicare because every year Congress has to adjust the Medicare payment rate or it will get cut, and that would be a problem. But Congress always manages to come to the table and fix that. So.
All right. Once an individual has used the connector and purchased insurance, will they have any further need for the connector? From Faye, Waialae. Any thoughts?
It's just like right now when you annually renew your plan, open enrollment, that will happen every year.
I think the other thing I would add there is that if the subsidy, if they found that they were eligible for a subsidy, that is the place in which they would continue to be eligible for it. So they would have the need to continue to make that purchase through there to be able to actually continue to take advantage of that lower costing premium.
It will be an ongoing relationship.
Yes.
Tony, something that you and I were talking about quickly before the show that I thought was interesting was that things are going to change a bit in terms of how the cost is calculated for plans.
Yep.
And for some businesses, there will be advantages for some businesses. For some businesses, if their workforce or their employees are perhaps middle-aged or so, they could see some cost increase. Could you explain that?
Sure. This goes to the requirement about how rates can be developed beginning in January 2014 for businesses. And the long and short of it is that historically, the way in which rates have been developed has been using basically taking a look back at how much of the health system has been accessed, how much has been used, and then projecting forward based on that, what the rates are like, what's likely to be used again. The requirement going forward, and this really is part of the ACA mandate for small businesses, is that you have to use age ratings. You have to basically determine how old is the population that you're covering within your group, and then applying a rate factor just based on that one factor. So if I'm a small business with a slightly older population, I would anticipate seeing slightly higher rates, versus if I'm a small business with a younger pool, I would probably see lower rates. And it discounts completely what the actual use is of that population. So some groups might see some swings just based on those factors alone.
Which brings up sort of a bit of an interesting issue about potential age discrimination. Now, of course, it's illegal, but for an employer, if they know that they might have to pay more if the worker is 45 versus 25, how do we prevent that from being a problem? Any thoughts?
Well, I think that, when that question has come up, because it's not the first time that I've heard that, generally speaking, the general thought is that employers will make the responsible decision to not allow age as a single factor to be used as a determination of whether or not to extend employment opportunities to employees.
So it might cost them more, but they're getting that person's experience and knowledge, and so it will balance out.
That's right.
Any thoughts?
Well, I think this has been an ongoing problem, the whole issue of age rating, and one of the things that AARP's members have told us about their concern in the individual market, there have been precious few restrictions on age rating, so that a person who was 64 might pay 10 times as much as somebody who was 21. And the law itself actually puts limits on how much age rating can be done. So it really greatly restricts the ability of increasing it, by a much more significant factor. So these things, you have to see how they play out. No law is perfect, and the sausage that we make in Washington, D.C., we keep remaking.
So the age issue could get adjusted in the future if it becomes a problem.
Yeah. Yes.
The biggest distinction is that it's the first time that has really made its way into the group market, and so that's why it's new to small businesses who've not really had that as part of a component of how those rates have been established.
And of course, we did talk earlier about these are all just projections at this point, but I'd be remiss if I didn't mention that for a group that did fall under that category, small business with older employees, they could be looking at some significant increases as high as 15%.
I mean, the rates of what a person could experience, definitely could have a big swing, and it's simply because it really wouldn't be based on what the rate was last year. It would now be really looking at the population that's being covered, and that's rates historically year over year have been more in line with how many people are you covering, and what was the use of your pool in the previous period.
Right.
Well, a couple more things.
Yeah.
I know that there's a lot of interest on rates going up, but it's also true under this new rating system that many people will see their rates go down.
Right.
That's a good point.
And then the other thing is this is a one-time transition. There may be changes this year, but the next year and the following year after that, I don't think we're going to see as many big swings.
And so this is sort of, we'll see what happens in the next couple of years to get a feeling.
That's
All right, we have lots of questions. Can immigrants, example from the Philippines, and COFA residents also obtain insurance through the Hawaii Connector? We actually briefly talked about immigrants. If you are a legal immigrant to the U.S., you will be able to get insurance, and your pre-existing conditions will no longer be a factor. So it's good news, right?
That's right. That's exactly right. You only have to be, you have to be a legal resident in the state, and of course that is, that's exactly what the idea is, that we're going to be providing access to health care for everyone.
Right.
And in fact, that person has to get it.
Right, right. And if you are a legal immigrant, this is good news, this new system.
True.
All right. From Honolulu, will everyone having insurance, both through the connector and independently, have the same quality of care, depending on what they purchase, huh?
Yeah. Go ahead.
One of the standards for qualifying these health insurance plans, and that's controlled by the insurance commissioner in the state, is that there have to be adequate networks of doctors and other medical professionals before they can even be qualified. So I think a lot of that sort of quality of care issue is taken care of at that level.
Okay. From Mike and Hilo, what would be a silver plan? Is that considered a basic catastrophic plan? It's not, it's higher.
It's definitely higher. It's definitely higher than catastrophic. I mean, a silver plan, if you think about it from the context of, say, platinum being at what we would call a 90% level, silver being, gold being at 80, silver at 70, and bronze at 60. If you just think about the cost of I'm oversimplifying this, but it's just for the purposes of the show.
Right.
If the cost of a visit to a doctor's office, say, was $100, the members or the participants' cost would be $30, and the plan would absorb the $70 because it's a 70-30 split. Right. If you go up to platinum, that would be at $90. The plan would absorb, and the member would absorb 10. And so, of course, the premium that's paid for the platinum versus the silver is a sliding scale that is going to be slightly less for silver than platinum because the plan is going to absorb more when they need services.
Right. All right. From Tony and Kailua, a question. The panel stated that there will be many plans offered, though at this time it looks as though there are only 4 plans. Is this true, or will there be more offered?
Go ahead.
For medical plans, the HMSA and Kaiser are indicating an interest in selling plans through the exchange, but each of them separately will have several different plans. I'm not sure exactly how many we're going to end up with, but there's going to be a lot of variable choices from each of those insurance companies. And then there's also 3 dental insurance companies that are indicating an interest in selling product on the exchange.
That will come through.
Yes.
The only other component that I would add to, and maybe answer the question, because I'm not sure if the viewer is calling in related to an individual or a small group, is that in the small group space, you're going to see a little less variance in terms of the number of plans offered, because the plans that are offered, even through the exchange, have to meet those requirements associated with the Hawaii Prepaid Healthcare Act. And so those plans are going to look very similar to the number of plans that are currently available in the market, which is fewer than the wide variety that we're trying to promote based on sort of what the person's need is when they're coming to get a policy.
All right. From Jane on Maui, what would happen if one spouse works for a small business but the other spouse's large company currently pays for the family's medical insurance? Would both employers be mandated to provide coverage? How would this work? Any thoughts?
Well, I have a thought about it. I mean, I can answer at least in part. Certainly, because if both employers are subject to the Hawaii Prepaid Healthcare, they both have to offer coverage. So that's just a requirement for them. If the spouse wanted to continue to take advantage of the larger companies offering an extension of coverage to the dependent, just as they can today. They could certainly decline coverage from the smaller employer because they didn't want to perhaps pay for it in whatever is offered there in terms of the cost sharing, and they will have met both their prepaid mandate as well as the ACA component.
You know, in that sense, I'm not sure it's really going to change. The Affordable Care Act isn't really going to change. I think people make the same choice today.
That's right.
Right.
Exactly.
This, I think, is actually an important question because if I'm understanding you correctly, there's a very firm answer to this. From Mike in Hawaii Kai, are there penalties for businesses? There aren't penalties. It's illegal, right? A business can't choose.
A business cannot choose not to offer coverage in Hawaii under the Prepaid Healthcare Act, and then there are requirements under the ACA as well, but the Prepaid Act exceeds those. So focus on what you're required to do under Hawaii Prepaid, and you'll be fine.
What people may have heard about in the news within the past couple of weeks was that there was a penalty and enforcement for large employers that was postponed by a year, but that's really not going to change anything very much in Hawaii because of what Tony just said.
Okay. Perhaps this is a question for Cheryl. If I'm not old enough for Medicare, collect Social Security, and have retirement savings, will that disqualify me from getting a tax credit?
So the question is, if this person collects Social Security but is not yet old enough for Medicare?
And has retirement savings.
And has retirement savings. And the answer is, it depends on how much you have. I mean, there are numbers. I think that it's hard, you know, we throw around numbers like 400% of poverty. You know, for a family of four, 400% of poverty is around $93,000 a year. That's a pretty decent income. So there's a lot of people whose families make less than $93,000 a year to cover 4 people. So, you know, and you reduce that if it's an individual, the number is lower. But these are middle-class people who will be eligible for subsidies.
Which is great news. So go to the website, find out if you qualify, or call. Don't go to the fake website.
I actually have a suggestion for you. AARP has spent a lot of effort trying to figure out ways to help people get information that they need. And one thing I would recommend is we have an interactive computer tool for those who have access to the internet or who have children who can access it for them, which is very easy to use. And it's at healthlawanswers.org. And you can get it through the AARP website. But if you answer a few questions on that, it will give you, depending on your state, so for Hawaii, it will give you the contact information for the Hawaii Health Connector. You put down how many people in your family, generally what your income is. It's going to tell you if you are likely eligible for a subsidy. So people can get pretty quickly a customized report printed out that will tell them exactly where to go and what they're likely to be able to get, so that they'll have some confidence when they go and talk about it and learn what it is that they need to do. And what's they're eligible for. It's for any age.
Same applies for small businesses too. In order to determine if they're eligible for tax credit, the HawaiiHealthConnector.com has a tool, as well as the Department of Commerce also has a tool. And we encourage businesses to reach out to their CPAs or in business organizations like the Chamber to be able to assist them to determine whether or not they're eligible.
They've got resources there. I have Medicare as my primary health care, and I have a supplemental policy. Will there be any changes I need to make? From Barbara in Honolulu.
No.
Okay, that's good news. How about this? I'm a 70-year-old Vietnam vet currently receiving primary care from the VA. I registered for Medicare, but not Part B. Will I have to do anything when the ACA becomes effective?
The ACA will not affect that.
Okay. All right, so no need. All right. How are the doctors, the real providers of healthcare, thinking about Obamacare? I hear many are retiring early or not wanting to participate. Of course, we did not have a doctor on the panel tonight, but is anyone hearing this?
I haven't heard that. I think that, in fact, the relationships that we've established working with doctors and really trying to focus on helping them practice at the top of their license has been actually we've been highly encouraged by some of the responses we've gotten from the provider community.
All right, that's good news. Tom, perhaps this is a good question for you. From Bill in Wailua. Hawaii has a mandatory auto insurance law, but only 65% are insured. How will the Affordable Care Act get to 100% insured in health insurance? Interesting question.
Well, the real answer is we're just going to have to wait and see, because we don't know what choices people are going to make once they find out, you know, about the law.
Correct me if I'm wrong, I guess the primary change there was we don't have any IRS control over our auto insurance versus there is IRS control here, right?
That is a major difference.
The IRS is the ultimate enforcer.
That's right.
All right, from Gary in Nu'uanu. I'm uninsured, and while the panel has a lot of good info, when I call HMSA, all I hear is I need insurance by January 1st and I can enroll come October, but we don't really know anything more about it. I'm sure you'd like to clarify on that, Tony. Any thoughts?
Well, I mean, it's the connector is going to open up on October, and then of course we're going to be starting to bring out those plans. We haven't launched the full inventory of the products. We certainly haven't launched all of what the pricing is going to be because, of course, we want to do that in conjunction with when the other carriers start to make that information available, as well as when even the connector starts to put that information out there. So I would encourage them to give us a call back at a time when we're really ready to start walking through who they are, as well as what plans are available for them.
Give the solid information.
Malia, I think that this does point out an anxiety that people have. The people who know about it have an anxiety because October 1, when you're supposed to start signing up, comes pretty quickly.
Right.
And people, so we all need to be thinking about what are the many ways that we can get information out to people and repeatedly, because people need to hear things a number of times before it really, they absorb it and they know what to do about it.
Yeah. But I suspect that when the question was framed around the idea of being able to get information around rates, information around the plan design, which we're not quite out there yet, but absolutely I agree with you 100%. Just helping them understand that there is going to be information. October is the application period, but January is when the coverage is going to go into effect. So they do have a little time, during the last quarter of the year to evaluate their options as well as really think about what they want to do.
And as long as you have insurance, there is no rush, there is no penalty, there's only opportunity really in looking at some other options. It's only if you do not have insurance that you need to get yourself.
And if I could just sort of comment, because one of the questions you asked right at the beginning was, what's the timing? When do people need to be thinking about it? And I just want to point out that the importance of, that although January 1 is an important date because it's actually when people have to comply with the mandate, but for the small groups, for small group businesses, it's really the first renewal after January 1, 2014. So if their renewal, their normal renewal with their current carrier is sometime later in the year, say for instance July, that's really when they need to be thinking about as far forward as when they're going to have to sort of make some decisions.
That's the timeline. Tom, I want to get really quickly to something that's been in the news, the Cadillac healthcare programs, policies, and this potential sort of fine. Can you explain what that is?
There's a provision in the Affordable Care Act that says if you have a really rich benefit health insurance plan that costs, and the dollar limits are set out for individuals and families in the law, if you have a plan that exceeds those dollar limits, then you could be hit with a tax penalty that's up to 40% of the cost of that plan. The thing that's important for people in Hawaii to know is that it's very unlikely that anybody has a plan, in the normal situation where they would be hit by that tax. There's some speculation that rates could increase, within the next 5 years or so, but we don't really know if that's going to happen.
And we're talking specifically about those plans afforded to state workers and that they could hit that level at some point in the future and therefore Hawaii would be fined. Is that correct?
Not really, because looking at what we have for state workers right now, I don't see any likelihood that we're going to hit that anytime soon.
So you think the press around that is a little bit premature?
Yeah.
Okay.
Yeah. I mean, I think we just don't know enough at this point. It makes a nice story, but I don't think it's a real issue here.
Your thoughts on that?
Yeah, my only thought would be is that I believe that if in the face of a significant penalty, the stakeholders would come to the table and really think through, what makes sense in terms of a go-forward strategy and look at ways in which to assure that money isn't really being spent on penalties that could be repurposed for enhanced benefits or bringing in that value back to the member or back to the state.
All right. If the HMSA plans in the Hawaii Connector are required to provide minimum benefits, does this affect the benefits in any of the other private HMSA plans not in the Connector? Do the benefits in private plans get reduced?
So the answer is, It's a difficult answer. It's a difficult question to answer. So there are going to be some plans that we have today that are going to have to be enhanced as we start to get into 2014, because they're going to they're no longer going to meet the essential health benefits. So those plans, they have to be beefed up to get there. As I think about really more of where most people are covered on the plans that we have today, most of them are in the group-sponsored space. And those plans are going to be almost identical to what they are today, because we had already gotten them to the point when the law was passed that brought them into almost full compliance with the essential health benefits.
All right. Sherry, let me ask you this question from Alice in Honolulu. We have people in low-income housing, recent immigrants that do not speak English and have no computers. How will they get services? They have no social worker or younger family members to help. The connector, I would imagine, has started to think through that.
Yes, and they will start having the information translated to different languages, so they are working in that direction. And once again, if they have any questions, they can call the Hawaii Health Connector office, and they'd be more than willing to assist them in the best way to address their questions.
The other thing your viewers might want to know is that I believe it's September 15th. The connector is opening a contact center. It's like a call center that people can call or email or maybe visit in person as well. And they're going to have language, translation capacity there to answer a lot of questions.
And that will be available. All right. From Barbara and Kahala, which insurance companies will be represented on the website? How can we get others represented to increase competition? We did touch on that.
Yes.
That's sort of a wait and see, though, issue, isn't it, to see who does come in?
That's right. We just have to wait and see.
Okay. Cheryl, are they seeing in other states an increase in interest by other insurance companies?
I think what we're seeing, well, it's all over the map, because each state is implementing this in its own particular way. Right. What we are seeing generally around the country is that there is more competition than people direly predicted there would be, and better rates. The rates are actually not, there was a lot of, oh my gosh, the rates are going to be through the roof. And the rates haven't been through the roof. And in fact, in some instances, insurers have actually gone back and reduced the rates from what they originally were going to be. So I think this is a wait and see, and I think we have a lot of faith that competition will make everything work, and that once it's seen to work, that other competitors are going to want to come in.
We have only a few minutes left in the show. Maybe we can use that time. You guys are out there on the front lines of this. What misconceptions do you hear that you would like to clarify for people out there? I know we've probably touched on a few of them, but what are the things that you get asked the most that you wish you could sort of convey? Tom, any thoughts?
I hope we have conveyed to the audience, it's been stated several times that for most of the people in Hawaii, not much is going to change. And I know a lot of folks are worried about that, but if you work for government or the military, chances are not much is going to change. If you are employed and you have insurance, probably not much is going to change. As Cheryl said at the beginning, it's really the folks who are uninsured, or if you're a part-timer and you don't have insurance, and some small employers, those folks really need to be paying attention, because their situation might change.
And get educated.
But otherwise, I think things are really going to be about the same.
All right, Cheryl, your thoughts?
Well, I'm actually with you on that one. I think that it's important for people to understand that they don't really need to do anything unless they are currently uninsured. The changes are actually going to be good for them, and they've already seen some good changes, and I think we've talked about that a little in preventive care, and in not being denied for insurance because you have a pre-existing condition, and not having annual or lifetime limits on your insurance. So there's a lot of good things that people are actually already experiencing, whether they have seen it or not.
All right. Sherry?
Sure. First, I'd like to commend the viewership for submitting questions. It's really great to have that kind of engagement and interest in finding out what they need to do to adjust to the ACA, the Affordable Care Act rules and regulations. One of the things that we hear from small businesses, do I have to go to the exchange? And that's not necessarily true. The exchange is an option, and the intent of the exchange is to make it easier for businesses to shop and compare the different insurance plans. So it is an option. So it all depends on what the businesses prefer. They could just go with the usual business and do what they're doing right now, or go to the exchange. Right. So it's not a requirement.
Yeah, I mean, I guess it feels like that's, you know, part of really what the sort of we're all saying, and I think it's important. Maybe where do I turn to get good information? And I think one of the things I'd like to encourage people to do is turn to the people that they have worked with and trusted all along. So if they have a relationship with a carrier, you know, identify the question that they want to ask and reach out to them and ask them the questions. And how does this affect me? How does this affect my business? And we're anticipating that much of what's in the marketplace today will remain the same. But of course, there are some new channels and there are some new opportunities, and so they should also carefully look at them. But I think they'll find that who they're working with today is also going to be able to provide insight to that as well.
And really quickly, in a year, 2 years' time, do you think the ACA will have changed from what we started with, or do you think that this will pretty much be what we're going to see?
Well, the interesting part that we haven't talked about too much tonight is the emphasis in the Affordable Care Act on changing the way that medicine is practiced. I think Cheryl touched on it earlier. There's a lot of incentives for doctors and the medical professionals to work more effectively and efficiently and to use you know, the dollars better to improve the health of the people of this country, which is really the bottom line. That's the real purpose of the ACA. And so in 2 or 3 years, to answer your question, that's what I'm hoping to see, is that costs will be moderated and the health of the country will be improving.
Well said. I think we could probably talk about this for 2 hours. There's so much to talk about. Thank you for joining us tonight. That was really interesting an hour.
Thank you.
In 2 weeks on Insights, we'll ask the question, should GMOs have a place in Hawaii's agriculture? The use of GMOs is sparking heated debates in our communities, pitting farmers against consumers. Some farmers say that without genetic modifications, farming, particularly papaya crops, would not thrive. Some consumers say they want to know if what they're eating has been genetically modified and what kind of pesticides are being used. Do GMOs affect our children's health and our environment? Could farmers make a living without GMOs and pesticides? Our guest will include Gary Hooser, a Kauai County Councilman, a farmer, and scientists who are for and against GMOs. That's next time on Insights on PBS Hawaii. I'm Malia Mattoch. A hui hou.